Hello, everyone. I'm Arya, your host for today's session, and welcome to today's FB Live. As I was saying, if you are Indian origin and living in US, so you do not need to worry about your parents' health in US. We have different packages for you, starting from $199 that provide access to 300 plus doctors from US, and we have 30 plus specialties. Prescription will be provided. They get back to you within 1 to 3 days of time. Family members can participate live via video physician consultation from any part of the world. Video consultation is about 30 minutes, and they have introduced a very affordable nutrition and health section for diet consultation, which gives you the chance to talk to expert nutritional coaches. We'll tell a bit more about this in the live right here, so stay tuned with us and visit www.eglobaldoctors.com to register yourself. In today's FB Live session, we will be exploring and providing more information about complications of diabetes. So for that, we have with us today Dr. Veena Watve. She's in practice, private practice, and has been working as a consultant endocrinologist in Houston, Texas for the last 14 years. She has a fellowship in endocrinology from Wayne State University and residency in internal medicine from State University of New York, Buffalo. Welcome to the FB Live, Dr. Veena. A very good morning to you. How are you doing today?
Thank you, Arya. Thank you so much. I'm doing well. Thank you very much. It's Saturday morning, quite early here, but yeah, I'm doing good.
That's great.
Sunday morning, actually. So not Saturday, Sunday morning.
Yeah. That's good to know. So we earlier did this session about about the diabetes guidelines, what is exactly diabetes, what all things you should follow, what to eat, what to not eat, and all that stuff. And we got really good response on YouTube as well. So here we are with another topic, a little upgraded about it, advancement with the complications of diabetes. So let me just start with our very first question. What are these health complications related to the diabetes?
Right. So we can divide the complications of diabetes into acute and chronic. Acute would be something that would happen immediately if your blood sugars go too high or too low. And chronic would be something that will happen after many, many years because of diabetes, which is uncontrolled, or just the fact that you've had diabetes for many years, that itself will make you at high risk for getting complications. So we can divide that into two, and we can go into details of each one of them. I think, Arya, you're muted.
I'm sorry. Yeah, so you said the acute and the chronic complications.
Yes. Okay. So yeah, I mean, acute would be, as I said, which would happen immediately. So due to high and low sugars. If you want, we can go into that first, and then we can go into the chronic ones.
Yeah, sure. We can maybe learn about the acute complications first.
So acute mainly, with the high blood sugars, with severely high sugars, if the sugar goes up to like 400, 500, which can happen, which seems very unlikely, but in some people's diabetes is that severe. I've seen blood sugars even in 1,000 plus in people who are admitted to the hospital. And that can lead to a condition called diabetic ketoacidosis. And that can lead to acid buildup in your body, just for lack of better term, that's exactly what it is. Our blood has a pH. For people who have some chemistry background, they will know that what is a pH, but basically the pH will drop and your blood will become acidotic. And this can be life-threatening. And the blood sugar does need to be brought down. These people are very dehydrated. They're sick to their stomach, nausea, vomiting, weakness, and it's not something that can be treated at home. They will need IV insulin, IV fluids. So when someone's blood sugar does go that high and they are sick, the family members should take them to the hospital, because this is a condition, this is the utmost complication that can happen with diabetes type 1 or type 2 with high blood sugar, acute complication, and you have to take them to the hospital to get them treated. So that would be the high sugar part. The low sugar part can happen in day-to-day lives, and that is if the blood sugar drops below 70, that's technically called a low sugar. Generally, people will have symptoms. They will have symptoms of feeling shaky, nervous, excessive sweating, as if they are going to faint. They have to eat something. And people will recognize this and they will eat something to bring up their blood sugar. But there are times after many, many years of diabetes, you may not feel those symptoms. And then next thing you know, you may be on the floor fainted, or you may have seizures, because the brain doesn't get enough glucose, and that can lead to seizures. So that would be the, another very serious complication, which happens very quickly. And, you can look at the patterns of sugar that every evening it drops or every morning it drops, whatever it is, and try to resolve that. This happens, more often in people who take insulin, because insulin is, if your insulin doesn't match up your food, if you, let's say, take a overdose of insulin and don't eat as much, or you're too active that day, that can lead to low sugar. So generally, these people are aware of how their diabetes is, and they are at risk for having hypoglycemia. The condition is called hypoglycemia, by the way. And they will, they should carry something in their purse or in their pockets, some candy or something, some chocolate, so that if this happens, they have something. And again, in type 1, this is much more serious, because, type 1 diabetic people have labile sugars, labile meaning they go up and down. And, it's hard to control. Something that people can do at home, which I'm not sure if it's very prevalent in India, is people, especially people who are on insulin and prone for this hypoglycemia, is they should have an injection called glucagon at home. So here it's very common. We do prescribe that for, especially for people who we think are at risk for hypoglycemia. So before ambulance comes, before, help arrives, you can put that in the patient, just like you can put insulin shot in the patient, you can put the glucagon shot. This is opposite of insulin. So just like insulin drops the sugar, glucagon increases the sugar. So you can give the glucagon and try to increase the sugar at home, because I know in India, the ambulance may arrive, sometimes it may be late, traffic, this, that. So precious minutes are lost, and what can the person do at home? But again, I'm not sure how commonly is it prescribed in India, and how expensive and all that, I'm not sure. But this is a package, at least here, it comes in like a package, and you should be familiar with how to use it, because, the family member will be panicky at that time and may not know how to use it. So familiarize yourself how to use it and keep it in your refrigerator, and God forbid, you should never need to use it. But if you need to use it, it should be there.
Absolutely, right. So this was about the acute complications that we learned, and there are also chronic complications. So what are they exactly?
So chronic complications, one can divide that into microvascular and macrovascular. What that means is macro means large vessels, large blood vessels. So, and micro means small blood vessels. So diabetes is actually a very bad disease. It can affect pretty much everything in the body, top to bottom, you name it, it can affect that. It can affect your brain, it can cause strokes, it can affect your heart, it can give you heart attacks, affect your kidneys can fail. There are people who end up on dialysis. Your eyes you can go blind from it. Your nerves, there are different types of neuropathy, and we can go into the detail of that, but people don't feel their feet the way they should be feeling it. They may feel pain. There might be circulation problems, so they may have ulcers or wounds that may not heal. So pretty much every system in the body is affected by diabetes. So people, high sugar sometimes don't give you symptoms, so people ignore it. They may have high sugars and for years, and nothing happens. So why do I have to take care of this? Well, over the years, your body does have a metabolic memory. Over the years, all these complications will stack up, and then there is no going back. So it's important to take care of your blood sugars when you are diagnosed, and you stay in the range. So there is a concept, I will try to bring this up right now because we are talking about it. There's a new concept called time in range. So, hemoglobin A1C is something that people, I think, are now aware. That's something standard that is checked in the labs. But time in range is a new concept, relatively new concept. So what that means is how much time in 24 hours do you spend in the range? So your hemoglobin A1C might be good, it's say 6.57, But if you're spiking up to 250, 300, and you're going as low as 60, remember hemoglobin A1C is an average. So your average is still going to stay okay. But those spikes, the ups and downs is what we don't want. We want that to stay in one steady range. So instead of doing this up and down, we want it more like this. So this is a new concept. And I think the Freestyle Libre, which is a sensor, is again becoming quite common in India. A lot of people, at least in the cities, use it. And that will give you more information about this. How many hours in a day do you stay in range? Because if you're going high and low, that will still lead to complications. So it's important that you stay in range. A1C, hemoglobin A1C is not the only thing that is there. So yeah, I mean, we can go into each complication, or you can ask me about each one of them, however you want to do it.
Yeah, thank you very much for all the detailed explanation there. Let me just tell our viewers and listeners that we are live on Facebook and Instagram as well. So log on into your favorite social media and ask your questions in the comments related to diabetes or any other complications you want to ask to the doctor here, and we'll be making sure to answer them right here in this live. Moving on to the next question, Doctor, what is diabetic retinopathy? If I'm not wrong, I'm pronouncing it correct. And what is this treatment?
Right. So that is the eye complication that I was talking about. And again, there are two types of it, non-proliferative and proliferative. But just for general terms, we can say that what happens. So in our eyeball, in the back side of our eyeball, there is the retina, which is like the membrane on which the image gets projected. And it has blood vessels. And what happens in diabetes is that the blood vessels can proliferate. See, sugar is a good medium for things to grow. So if you keep a high sugar, the blood vessels are going to grow, the cells are going to grow. And in non-proliferative retinopathy, it may form like pouches, which can lead to swelling. Swelling in the macula. There is another membrane called macula, or the tissue called macula. And there is a thing called macular edema. What that means is there is a swelling in the retina, which can give you, decreased vision. A little bit more advanced would be the blood vessels will proliferate and they will actually break down and leak blood. And there can be bleeding inside the eyes. So this would be much more serious, and that does need attention. The bleeding can be stopped by doing laser treatment, photocoagulation. And for this, we do recommend that at least once a year, you should go and see an eye doctor. If you're a diabetic, you go and see ophthalmologist. I don't think, again, this is much more prevalent in India as much. I don't think people go to the eye doctors as frequently. They will go to check their number, prescription number, but they won't necessarily dilate their eyes and look inside the eyes. So something that's very commonly done here, but please go and do check it up once a year, because these can be prevented if they are recognized early on. There are treatments given. There are also injections now. I'm not an ophthalmologist, so I don't know a lot of details, but there are injections that can be given into the eyes, which will decrease the proliferation of those blood vessels and halt that process, so that something worse doesn't happen, so that they don't bleed and you don't go blind. There are people who can go blind from this. But yeah, that is what is diabetic retinopathy in a nutshell.
Okay. Wow. So we have earlier discussed about these the general diabetes terms, and I wanted to ask, like, what causes these complications now to rise after a person is diagnosed with diabetes?
So there are several factors. Number one factor is how well is your diabetes controlled. If you higher the sugars, higher the risk of complications. Number two would be the number of years that you have had diabetes. So to give you an example, more than 10 years of diabetes, 80% of the people will start having retinopathy eye complications. So more the number of years you spend with high sugars and the metabolically toxic state. Again, generalizing this, but longer you have diabetes, longer is the risk. So best is take care of the diabetes right in the beginning. People think that, I'm young, it's okay, I have to think about this later in life. No, there is no such thing. your body does have a metabolic memory. They have done studies that it can lead to, let's say, if you were uncontrolled for 6 months or a year, and then you woke up and then suddenly decided, I'm going to take care of this, and then you took care of it for, let's say, next 5 years. They've done studies that, people who didn't take care of it for those 6 months to a year, and people who did take care of it all those 6 years, in the end, after those 6 years, people who didn't take care of it still had bad outcomes and still had more complications, had more heart disease, strokes, and all of that. So my point is that our body does remember. So don't think that I will take care of this tomorrow. The damage that's done for those 6 months, 1 year, your body will remember that, and you will have a bad outcome.
Absolutely. So like you said, the higher the sugar level, the higher the chances of complications. So at what blood sugar level do these complications start, to be precise?
So, I can't tell you pinpointedly like this blood sugar level, this is when it starts, but I can say that the A1C of 7 and plus is when the graph of complications will go exponentially high. So if you plot a graph of A1C on the x-axis and y-axis complications, between 6 to 7, it's quite flat. That graph is quite flat. And as you progress, it goes exponentially high. So bringing your A1C down from 9 to 8, 8 to 7, you're going to have much more benefit as compared to bringing it from 7 to 6. So not to say that you shouldn't be aiming for 6, but I'm just saying that higher the sugars, it's exponentially higher. So aim for A1C of 7. As I said, the time and range is important. So not just the A1C, but how much time do you spend in range? So do check your sugars. If you don't have a sensor, do check your sugars. Make sure you're not going over 200 too often. So again, people have a concept. Yeah, I ate, some sweets and my sugar went to 250, but it came down after four hours. It came down to 120. So I'm fine. No, you're not fine, because that 250 blood sugar still ended up doing some damage. I know once in a while this can happen, but just let that not happen often. Just be aware of it.
Okay, right. That's right. So I have related to these complications of diabetes, I've read about this non-alcoholic fatty liver. So what is that, and what is the treatment for it?
So it's not necessarily a complication of diabetes as such. It is a complication that is very common nowadays because of the obesity increase. Obesity is linked to diabetes. So a lot of times this non-alcoholic fatty liver disease is linked with diabetes because they go hand in hand. So essentially what it is it's fat in the liver. For lack of better terms, that's exactly what it is. Again, the concept of metabolic fat, so meaning the central fat, what goes in your gut. All your organs can get fatty tissue such as liver and kidneys, and that is the metabolic fat, and that is what is bad for you. That is the metabolic toxicity. So when you lose weight, you lose the gut weight. The subcutaneous fat is not as bad, or it's not bad at all. So when people say, oh, you have thick thighs or thick bottom, that's not as bad as the thick belly. So that is what is the metabolic fat, and that's what leads to the non-alcoholic fatty liver disease. And majority of the times that will not cause much symptoms. There may or may not be increase in the liver enzymes. And but if it goes to hepatitis, steatohepatitis, then that becomes more serious, and sometimes, rarely, it can go into liver cirrhosis. So nowadays, alcohol is no longer like the topmost reason for liver cirrhosis. The obesity is on the rise so much that unfortunately that is a common cause of liver cirrhosis. So yeah, losing weight would be the number one treatment. There are some other pills that can be prescribed. I won't go into details of that, but number one thing would be losing weight, and then the gut obesity or the central obesity is what you want to lose.
Right. So as you mentioned about the obesity being a factor, so what other factors are there that trigger these complications associated with diabetes?
Well, it all goes hand in hand, right? You can't really separate out obesity and diabetes. All goes hand in hand. But I will say that diabetes puts you compared to a normal population, you are putting yourself at 4 times at as much risk of getting a heart attack, stroke, as compared to a normal population. So, and then along with it, everything else goes, like blood pressure, cholesterol. So in a diabetic patient, we are much more stricter in controlling the blood pressure, controlling the cholesterol, whereas someone who doesn't have diabetes, we can let go. The guideline is not to keep it very tight, but with diabetes, we want all these numbers to be very tightly controlled because of the increased risk of all these complications.
Right. So before moving to our last question, let me tell everyone, our viewers and listeners, about the new diet consultation. So we have different categories: diabetes remission, detox program, weight loss, child nutrition, gut health, menopause nutrition support, and many more, where we can help people understand the root cause of the problem and provide suitable and healthy solutions as per their dietary requirement and lifestyle habits. So register yourself today to get a personalized nutrition coach for you. Coming to the last question, Dr. Veena, how can someone prevent or delay these complications if they are diagnosed after they are diagnosed with diabetes?
So again, touching base on the same, points, what I said, that, making sure the blood sugars are okay, losing weight, checking your blood sugars, keeping them in the range. There are, for eye complications, making sure that you do see an eye doctor once a year. For heart, you can see a cardiologist, get a stress test. I wouldn't say that you have to get a stress test every day, every year or something, but whatever your doctor, depending on the rest of the risk factors, whatever your doctor feels is appropriate for you. But again, be aware of it. You should take aspirin, baby aspirin a day. Again, depending on case by case, depending on what else is going on, your doctor will recommend that. Keeping your blood pressure controlled, cholesterol controlled. I didn't talk about neuropathy much, so let me just touch base a little bit about neuropathy. So what neuropathy is, that it does cause nerve damage. And what that means is that there is circulation everywhere, right? So your nerves also have circulation. And because diabetes can affect circulation because of poor circulation, so imagine the nerve has an insulation, like a sheath on top of it. So imagine that like a wire which has lost its insulation, something like that. So the sheath will slough off, or it will go away, and that raw becomes kind of raw, and the nerve becomes kind of raw. So that will trigger some excessive either pain or some different sensation. People sometimes describe as if they are walking on cotton. They may not feel the ground, which is what leads to falls. Falls will lead to more complications. Number one would be pain. Some of them have really painful neuropathy. They have to be on pain medicines all the time. There are people who may walk outside, may not feel what is under their feet, and next thing they know, they have in the hot sun, they walk on a pavement, they have third-degree burns. It seems very unlikely, but this does happen. Or they may step on a nail, and next thing you know, there is a puncture wound, infection, ulcer there. They didn't even know because they have no pain. And that's, one thing leads to another, that leads to osteomyelitis, or, ulcers, which the legs need to be amputated. So leg amputation is one of the complications, because remember that diabetes is also poor circulation state. So good oxygen, good circulation is not going to that wound. So the healing is also poor. Any wounds that you have, they may not heal as quickly. So what we tell patients, again, once a year, at least your doctor should be examining your feet, looking out for neuropathy signs and symptoms. And, there are some tests that can be done for neuropathy too. But we tell our patients to, when they come out of the shower, always look at your feet, examine your feet, because you sometimes never know. There might be something there, and since no pain, you may not even know that it's there. So always examine your feet, keep them moisturized, keep them, in good state of health. Cut your nails, because the nails also can lead to some problems. You might get hurt, or they might get fungus, things like that. So, that's what you can do to prevent the neuropathy, peripheral. By the way, this is called peripheral neuropathy. There is another kind of neuropathy, which is called autonomic neuropathy, meaning these are nerves inside your body. again, for lack of better terms, I mean, I'm just simply simplifying everything, but I think the people will understand that more. And that can lead to gastroparesis, which is, imagine the stomach doesn't move. The food is in the stomach, but it doesn't go further. And that's what leads to nausea, vomiting. And then that's a very tricky situation because, you know, I mean, you may have hypoglycemia, you don't want to eat, you have nausea, all those things. But this doesn't happen until much later. So all this can be prevented if your blood sugars are under control. Another one, which is very important for men, it would be the erectile dysfunction. So it can affect the sexual life as well. And, you know, for men, if nothing else drives it, I'm sure that will drive it. You know, they will make sure that the blood sugars are under control. So erection can be affected. Erectile dysfunction can happen in men. And this is, again, part of the autonomic neuropathy. So all this it goes hand in hand, making sure you're aware of your body, go see your doctor, make sure you're taking your medicine, make sure you're keeping those blood sugars under control, and examining your body, you know, your eyes, your feet, all of that, making sure that you go to the right doctors.
Wow, great. So I think you pretty much touched all of the major points that we wanted to discuss in this session for the complications of diabetes. And I don't see any questions as of now. So with that, I guess it's a wrap. And thank you so much for taking out time and providing such valuable information about the complications of diabetes, as we had already done the general diabetes topic earlier. So thank you very much, Dr. Veena, for today's session.
Thank you so much. And if there are any questions, I'll be happy to answer them in the chat later on.